Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss the parathyroid gland, its development, and its normal and abnormal position. Parathyroid gland is the endocrine gland, usually 4 in number, but number may be vary from the 2 to 6, and they are situated just behind the lobe of the thyroid gland. This is superior parathyroid gland. It is situated the posterior border of the thyroid lobe, just above the midpoint. It is also related. This is the inferior thyroid artery. This is recurrent laryngeal nerve, and it's situated just above the inferior thyroid artery. The location of the inferior parathyroid gland is vary. It has some developmental explanation, and it's situated mainly just below the inferior thyroid artery, or from 1 centimeter within the inferior pole. The development of the superior and inferior parathyroid gland. This is the first pharyngeal pouch, second pharyngeal pouch, third pharyngeal pouch, and fourth pharyngeal pouch. From third pharyngeal pouch, the inferior parathyroid and thymus gland is developed, and from fourth pharyngeal pouch, the superior parathyroid gland is formed, and it reaches its final position. But the inferior parathyroid and thymus is derived from the third pharyngeal pouch, and they start to descend. And when the inferior parathyroid gland is reached in the lower pole of the thyroid gland, posterior surface of the thyroid lobe, it usually stops its descent and detach from the thymus. But sometimes it's not detached from the thymus, and it's go with thymus and reach the superior mediastinum, and very rarely it may found within the tissue of the thymus. And inferior parathyroid gland sometimes found in front of the trachea. Sometimes inferior parathyroid found outside the facial sheath and behind the esophagus, and very rarely it may found within the thyroid gland tissue. So this is all about the normal and ectopic location of the parathyroid gland. These possible aberrant sites are of course of great importance in searching for a parathyroid adenoma in hyperparathyroidism. The parathyroid are usually safe in total thyroidectomy because the posterior rim of the thyroid is preserved. However, they may be inadvertently removed or damaged, which result tetany due to the lower serum calcium. So this is all about the parathyroid gland. If you like this video, please press the like button. Please subscribe my channel.